Good morning. If you have decided to study and you want to become a professional hypnotherapist, keep watching our training videos about clinical hypnosis. Hypnotherapy is an effective technique with which you can help and improve the quality of life of a great number of future patients. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis, and also you can download several ebooks also free. The information in this video is extracted from our book Direct Clinical Hypnosis, Deep Hypnosis, of our publisher Clinical Hypnotherapy, registered with ISBN. Direct Clinical Hypnosis, Depersonalisation and Derealisation, Part 2. Depersonalisation. The first descriptions of depersonalisation appear in 1872, Chris Haba, but the name depersonalisation was not used until 1898. Douglas. Depersonalisation disorder is characterized by persistent or recurrent feelings of being detached from one's own body or mental processes. Heitoscopy, perception of the image of one's own body as a mirror image within perceptual space. The double image can be total, whole body, or partial. What is lost is the judgment of reality, as there's the patient's conviction that this image is his or her own. A person with depersonalization disorder usually feels as if he or she is an observer of his or her own life. They may feel themselves and the world as unreal and in a dream. Depersonalization can be a symptom of other psychiatric disorders. In fact, depersonalization is the third most common psychiatric symptom after anxiety and depression, and often occurs after the patient experiences a life-threatening situation such as an accident, assault, injury, or serious illness. The person with depersonalization has a disordered perception of their identity, body, and life, which makes them uncomfortable. Often, the symptoms are temporary and appear at the same time as symptoms of anxiety, panic, or fear, phobia. However, the symptoms may last or recur. Symptoms may last or recur for many years. People with this disorder often have great difficulty describing their symptoms and may fear or believe that they are becoming mentally disturbed. Depersonalization may be a minor or temporary annoyance with few obvious effects on behavior. Some people may adjust to personalization disorder or even block its impact. Others are continually immersed in anxiety about their mental state, fearful of going insane or ruminating on distorted perceptions of their body and their sense of detachment from themselves and the world. Mental anguish prevents them from concentrating on work or the routines of daily life, and they may become invalid. Depersonalization, derealization. Symptoms of depersonalization and derealization have been recognized as part of the depersonalization image, have been recognized as part of the clinical picture of a wide variety of mental disorders. Common features of both are a temporary disturbance in the subjective experience of reality, so that a sense of remoteness or lack of reality replaces the general quality of familiarity associated with perception. In depersonalization, the disturbance occurs in the perception of self, and in derealization, the disturbance occurs in the perception of the outside. In depersonalization, derealization disorder, we have depersonalization and derealization as the main symptom. When we have an anxiety disorder, there is no actual traumatic event, so we concentrate more on the defense mechanisms of derealization and depersonalization. These mechanisms make us feel strange. We can start to be afraid, and the more anxious we become, the more we focus on them, and our mind makes these defense mechanisms work to help us. From our point of view, for us, and always based on our clinical experience, depersonalization, derealization disorder is not a pure disorder. That is to say, it is secondary. It is caused by another disorder, primary disorder. What we have to do is to treat the disorder that has triggered it, and the personalization, derealization will disappear by domino effect. It usually appears as a result of depression, severe anxiety, obsessive-compulsive disorder, OCD, social isolation, hypnagogic or hypnomnic effects, etc. They have a good prognosis. The problem is if the depersonalization, derealization is secondary to taking a drug, if on withdrawing the narcotic substance, which is what has caused the depersonalization, derealization, and after a period of detoxification and detoxification, the depersonalization, derealization does not disappear. This would possibly indicate that there is neurological damage and the depersonalization, derealization becomes chronic, and only relative improvements can be found with medication, almost for life. There are moments of improvement, but the depersonalization, derealization does not disappear completely. In this case, treatment with both psychology and hypnosis can only improve the patient's quality of life. Treatment. Therefore, the treatment consists of treating the primary disorder, which as a consequence has led to the secondary disorder, which is depersonalization, derealization. If, for example, the depersonalization, derealization is caused by depression, the treatment to be followed will focus on the depersonalization, derealization. The treatment to be followed will be focused on the solution of that depression by having therapeutic results and seeing the patient's depression begin to subside. The depersonalization, derealization will also diminish. All of this will make them enter into a spiral of hope that will further increase the improvement of their depression and the disappearance of the depersonalization, derealization. The hypnotic treatment can be reinforced with secondary exercises. For this particular disorder, we have a secondary exercise that directly treats this disorder. Thus, depersonalization, derealization will be treated indirectly with the treatment for the primary disorder that has led to the occurrence of depersonalization, derealization, and directly with the secondary exercise. Connection with the inner body. Now, we are going to look at a very effective secondary exercise for patients suffering from depersonalization, derealization. This is a secondary exercise, that is, an exercise to reinforce and support the primary exercises of the treatment to be followed. Whenever we are dealing with the depersonalization, derealization disorder, we will treat the primary disorder that has led to the depersonalization, derealization, which will then subside by a domino effect. In this case, we will support ourselves with the following secondary exercise. Focus on your body. Direct attention to your body. Feel it. Feel it from the deepest parts of your being. Feel it from the inside out. You are alive. Feel every cell full of life. Feel every organ full of life. Feel every part of your body permeated with life. There is life in your feet. There is life in your legs. There is life in your waist. There is life in your chest. There is life in your shoulders. There is life in your arms. There is life in your arms. There is life in your hands. There is life in your neck. There is life in your head. Feel your whole body full of life. Feel it. Feel the energy field permeating your whole body, feeling everything with life. Feel it. Feel it. Feel it in all parts of your body. Feel it. Feel it. Focus on the pleasant sensations coming from your body, from the inside out, without thinking. Just feel it. Enjoy the pleasant sensation of feeling alive. Now visualize how little by little your whole body is illuminated from the inside out, more and more enlightened, more and more and more enlightened. Now you're all light. Now you connect with your inner body. Now you see it all more real. Now you feel more and more yourself. Now you are more and more centered. Now you feel your mind clear, calm and quiet. Everything shows itself when it is exposed to the light, and what is exposed to the light becomes light. If you're interested in learning more about clinical hypnosis, watch our next video, Hypothermia Indirect Clinical Hypnosis, How It Works, Part 1. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis, and also you can download some ebooks also free. On this topic and many others we'll talk about in the channel and in the videos that we'll publish. So, if you're interested, do not miss our next videos. Thank you very much.